Hi, I'm Dr. Eric Spiegel. I'm a licensed psychologist in the state of Pennsylvania and the practice director here at Attune Philadelphia Therapy Group. Today I'm here to answer your questions about therapy for anxiety. So one of the first things to understand about anxiety is that there's no one-size-fits-all approach. There's different types of anxiety. There's OCD, there's generalized anxiety disorder, there's phobias, there's traumas, there's social anxiety. So there's a lot of specific types of anxiety presentations. And then, of course, there's just, the kind of anxiety that's really important to understanding yourself and your issues, but might not fit a diagnostic criteria box. So one thing to consider when we talk about the different treatment approaches is that it might be all of the above. We might incorporate a bit of each of these treatments, or we might just focus on a particular type of anxiety, and that's going to really fit the person. It's not going to be specific to all treatments. But in general, there are three types of anxiety approaches that I really think are the best approaches to treatment. There is the one that gets the most empirical support, which is cognitive behavioral therapy, and a specific type of behavioral therapy called exposure therapy. And the idea with exposure therapy is that by exposing someone to the particular thing that they're afraid of, it extinguishes the anxiety response. Because basically, when you're anxious, you actually avoid the thing that you're afraid of, which just actually heightens that anxiety response. So by having a controlled exposure to what you're anxious of, it lessens the anxiety response. Then there's something called psychodynamic therapy, which is very different. The idea with psychodynamic therapy is instead of a more behavioral or cognitive approach, we're really trying to kind of understand the origins of your anxiety. And that can be particularly helpful when the anxiety is more symbolic. So when it's actually symbolic of something a bit deeper, maybe it's related to your childhood, maybe it's related to a traumatic experience. But for some people, really having a better understanding of the nature of their anxiety can be very helpful. And then there's a third type of treatment that I just sort of lump under the general term experiential treatments. And this is things like mindfulness, things like hypnosis, really any type of treatment that works with physical-based symptoms, that works with sensory experiences of anxiety. And the idea here is to teach someone skills that they can use to elicit calm, that they can use to elicit presence, that they can use to really kind of work with the more bodily or somatic responses to anxiety. And so that's it, folks. That's the three types of treatment that I'd recommend for anxiety. Again, there's no one-size-fits-all treatment. A lot of it is about a really good assessment that you have with your therapist so that they can come up with a plan that works the best for you. For more information, feel free to visit our website. It's www.therapistsplural.inphiladelphia.com. Again, that's therapistsinphiladelphia.com /challenges/anxiety, where you can learn more about our anxiety approaches or just learn more on the website about who we are and what we do. Thanks so much. Have a good day.